So my presentation is on von Willebrand disease, so I'm going to go ahead and share my PowerPoint with you. So von Willebrand disease is a disease that is related to problems with something called von Willebrand factor, which is a protein that helps different parts of clots stick together, specifically collagen, platelets, and something called factor VIII. Von Willebrand disease is caused by either lack of von Willebrand factor, less effective forms of von Willebrand factor, or destruction of von Willebrand factor. Usually, in most cases, it's inherited, and you have it as soon as you're born. It may be acquired at any point in your life, but that's a lot less common. So the types of inherited von Willebrand disease, each of these types can be caused by multiple mutations. There are around 300 mutations that can cause some form of it together. So type 1 is about 75% of cases, and it is passed down through autosomal dominant inheritance. And what makes it type 1 is there's a partial decrease in von Willebrand factor. So you have less, you don't have, you still do have some, so and it works fine. So the von Willebrand factor that you do have works well. So you're going to bleed for longer, bruise more, but it will probably still be mild enough that you might not even know you have it, depending, or you might. There's a large continuum of von Willebrand disease, but this tends to be more towards the milder end. Type 2 is usually also autosomal dominant, but it isn't always. Sometimes it's autosomal recessive. And what makes it type 2 is the von Willebrand factor that the person has is abnormal. It's mutated, so it's not as effective at. There are different mutations that decrease the efficacy of binding to different parts of the clot. Type 3 is the most severe kind. It's autosomal recessive, and in type 3, the person has such low levels of von Willebrand factor that they're undetectable in tests. So that's going to be a lot more severe bleeding. So it can also be, von Willebrand disease can also be acquired. There are several ways that this can happen. One can be the body's own antibodies attack the von Willebrand factor. This is caused by some autoimmune disorders and some cancers. The von Willebrand factor can be broken up in your bloodstream by something called shear stress. And that is due to some congenital heart defects, some implants that are could be put in your heart, but that breaks the von Willebrand factor down too quickly. Adsorption, von Willebrand factor is cleared out of the bloodstream too quickly in some cancers. And it can also, von Willebrand disease can also be acquired as an adverse effect from some drugs, valproic acid, ciprofloxacin, griseofulvin, hydroxyethyl starch, and dextrins. So you can acquire it that way as well. The signs and symptoms, as I said, it's a clotting disorder, so mostly excessive bleeding and bruising. Many cases are mild. There's a whole range from mild to very severe. So a lot of people don't necessarily know they have von Willebrand disease. They might know that something is wrong, that they are more prone to bruising and bleeding than other people, but it's not always identified. So it is passed down by on autosomal chromosomes, not sex chromosomes. So it's essentially equal numbers in men and women. But symptoms are worse for girls and women who menstruate or give birth because of blood loss. So when we're talking about ways that people might figure out that they have von Willebrand disease, it might be for a kid. If a kid is bruising excessively or bleeding for a really long time after after just normal seeming injuries. They fall down on the playground and they just have horrible bruises. Or if they have another one that's common is very long nosebleeds. If they have nosebleeds repeatedly, they're lasting more than 10 minutes, that's a sign of something going wrong. Sometimes girls discover that they have von Willebrand disease at puberty if they're having really long, really heavy periods, if they're losing clots of blood bigger than a quarter, if they're having to change their period products, whether that's a pad, a tampon, a menstrual cup, more than once in a 1 to 2 hour period, that can be an indicator that there's some sort of bleeding problem going on. So, and if someone is having some of these signs and symptoms, we might think that there's something going wrong with their ability to clot. So we might do more general screening tests, like a complete blood count, to assess, von Willebrand disease isn't going to directly affect anything on the complete blood count, but if your hemoglobin and hematocrit and red blood cells are low, that can indicate having lost a lot of blood. We can check various labs that tell us about clotting. So activated partial thromboplastin time, prothrombin time, to assess how fast someone is clotting, and also fibrinogen, just to assess their ability to clot. If we're seeing problems in all these labs, that's a screening test. So it doesn't tell us that they have von Willebrand disease, but again, it says that there's something wrong with clotting. Diagnostic tests for von Willebrand disease, which you might do either because of signs and symptoms, because of some of the screening labs being abnormal, or maybe they have a family member, like a parent or sibling, who's been diagnosed with von Willebrand disease. In those cases, you might do tests to see if they also have it. There are specific diagnostic blood tests. Von Willebrand, you can check for von Willebrand factor antigen, von Willebrand factor activity, factor VIII clotting activity, and von Willebrand factor multimers in blood. Treatment, so there's kind of two parts of treatment. The first one is getting them more von Willebrand factor. So you can use desmopressin, which is a synthetic hormone, and it stimulates the release of more von Willebrand factor. Not everybody responds to this. It's more likely to be for people who have somewhat milder cases. But if someone doesn't respond to desmopressin, they may also be prescribed concentrated von Willebrand factor, and factor VIII, that is exogenous. They didn't make it themselves. If they're just not able to make it, or to make enough, or to make the right kind. In addition to increasing that von Willebrand factor, you also need to manage their symptoms. So say it's a teenage girl who is having really bad anemia associated with her periods because she's just losing a lot of blood. You might try oral contraceptives to control her periods, try to make them such that she doesn't lose as much blood every month. You could use for other non-menstrual things, you could use antifibrinolytics, so clots are staying around longer and they're not breaking down as quickly. And you can also use a topical thing is fibrin sealant, so you can put that directly on cuts and things like that to sort of help the body clot, so it doesn't have to do it all itself. If you have any questions, let me know. Feel free to respond to this post, or contact me in whatever other way. Here are my sources. You're welcome to click through them. And I'm also going to post my slides and my paper. So if you want to take a look at that, you're welcome to. Thanks for listening. Have a nice day.